I am here with my friend and colleague, Dr. Martha Makwero, who's come from Malawi in southeastern Africa. And she's here for a short visit to Swedish with the background of helping develop an academic partnership between Swedish and the College of Medicine in Malawi. And so I'm going to ask her a few questions. Welcome, Martha.
Thank you, Elizabeth.
So I met you in August 2014 when you were just taking the role of the Department Chair of Family Medicine at the College of Medicine in Malawi. Can you tell me a little bit about family medicine development in Malawi and why the Ministry of Health is prioritizing family medicine as a specialty in Malawi?
Yeah. First of all, I must say that I think the time you met me was exciting and challenging because this is the first time we are rolling out family medicine in Malawi at postgraduate level. And the idea is that they improve human resource within the district health system, which has for a long time suffered lack of human resource among other resources. So this is an idea that came through academics, but also people that have worked in rural areas, especially Christian medical organizations or hospitals that, you know, serve the underdeserved situations. So in underdeserved circumstances. So this is the first time we are making deliberate efforts to train people who will serve in underdeserved populations, but also making deliberate efforts to train them there. Malawi is excited to take on to this challenge, and scary at the same time. Ministry of Health is quite positive about the development because it will keep people where they're needed to be. As you know, that 70% of Malawian population resides in the rural areas. That is actually served by these doctors that we envisage to produce.
So as you mentioned, your role is also academic. You're in charge of about 100 medical students and 3 family medicine residents per year. The medical students have a 6-week family medicine rotation in a rural area, and the residents, the curriculum is a 4-year curriculum. And there's only 2 other faculty who are consistently based in Malawi on your team, other than volunteer faculty. So that's a lot of work for a small number of people. So I'm wondering what support you need to develop family medicine in Malawi, and how do you see that support helping the work that you're doing?
Yeah, sure. I think we need support on several fronts. You're right that we have run the undergraduate program from 2009, and that has incited a lot of interest within family medicine, and that we have potential to grow. And this is why we have had a pool of postgraduate doctors wanting to specialize in family medicine. And we indeed have started the postgraduate program. That's a lot of work actually to implement the first family medicine curriculum within the context. And more so, I think we want to champion training doctors in a district hospital setting, which is not an academic site, which has traditionally not been an academic site. So that brings in with a lot of challenges. But also our greatest need is to try and define this family medicine within our context, how it fits in and how it works, and how we can show value within the district health system. So when we talk about that, we talk of research. So most important, I think we need more bodies, one, to help with the many roles that you have just described, and more of which we have also talked about undergraduate, postgraduate research, and even resource mobilization. We need more bodies, both short and long term, to come. The other thing is we need role modeling we need people to help us, you know, sing the song and help us, you know, function in the setting and be able to start effecting change.
I have one more question for you.
Okay.
And that is, last year when you and I were together there, we had 14 residents from Swedish and OB fellows come and work alongside us doing some of the work that you describe. And we're hoping to carry that partnership on for about 5 years at the minimum. And so I'm wondering what you see of the advantages of the partnership. How did you see it working last year, and how do you see it going forward to the future?
Yeah, I think last year we had these residents that, first of all, I think they tried to change the ambience of the environment we worked in. Their presence helped us to bring an academic environment to what we do in their work, mentoring clinical officers and medical assistants and nurses and even students. And the ambience changes, you start building teamwork, and you start moving as a team, which is very, very core to our family medicine agenda. Secondly, I think they helped a lot. Out there, I think simply we need more bodies. And we saw these registrars, you know, taking on responsibilities from day one, helping with precepting, helping with clinical work. And what we hope to do is to continue indeed this partnership. And we hope that you benefited too, much as we benefited.